Doctors of Reddit, what was the most difficult situation you had to face in your medical practice? Pediatric non-accidental trauma aka child abuse. Recently had a 4-year-old with partial and full thickness, 2nd third degree, burns over about 50% of his body. This was punishment for the child having diarrhea. The kid had been suffering through horrible pain for 4-5 days before police CPS found out and brought him in. He was a really sweet kid during the whole time I was caring for him. It's shocking how horrible people can be to others, especially to children. Bit of different perspective. I work non-medical public health in some of the worst parts of the world. I still dream about my time in South Sudan where I would regularly came across people so desperate for care you get choked up even seeing them. A mother with half her head caved in from a rifle butt, kneeling in front of her hours dead family. A man with such profound filarial elephantiasis his knee was the size of a medicine ball. A 9-year-old pregnant girl. A boy I saw die after being bitten by a mamba. Hundreds of trachoma-related blindness. Be thankful if you live somewhere with rule of law and clean water. I'm a psychiatrist. I once had a patient with such severe schizophrenia that there was nothing I could do to help her. I mean, I could medicate her, but the drugs I had to use were so powerful that they essentially left her mute and incapable of clear communication. All she could do was sit and stare. It really broke my heart and left me feeling quite helpless and powerless because there was simply nothing I could do. There were only two extremes in which she lived. So powerfully deluded and paranoid that she was a danger to herself, others, or so medicated that she was a shell of a person. For her own safety and the safety of others, I had to medicate her. This occurred when I was a senior OBGYN resident. Another hospital had just done a 24-year third C-section. Good Friday afternoon, and had encountered a placenta accreta. Placenta grows into the muscle wall that they thought they were able to control without a C-hysterectomy. A few hours later she began hemorrhaging and they then took her back and did a hyst, but she was bleeding so quickly the hospital began running out of blood. They had to transfer the patient to us on a 40-minute ambulance ride. I thought we could save her so long as she didn't arrest and we were able to get her enough blood products. We met her at the ambulance bay with rapid infusers and the full OR team scrubbed and ready to take her back to surgery. She eventually received 30 units of blood from 30 different individuals. Me and 3 other doctors worked furiously to stop all her bleeding, but she had entered full-blown dick. Your blood no longer has any clotting factors and all surfaces begin bleeding spontaneously. And she began bleeding into her lungs and went into hypoxic arrest. What hit me hardest is that I really didn't expect her to die until I began hearing the O2 sat monitor begin beeping at lower and lower tones and I saw it in the 60s. I will never forget the deep groaning sensation you get in your belly when you know the patient you are working on is going to die. The PT's father and her so did not expect it either. I had never heard a man wail until my attending and I came to tell them that their loved one had passed. I am not religious, but I was so thankful that our hospital had an on-call chaplain, which helped me process the situation. I actually started my week vacation a few hours later, which may seem like bad timing but helped me get over the tragedy. Not a doctor, but an EMT. My high school was pretty big in career technical education, so when senior year came along, I decided to try the after-school, year-long EMT basic course as a part-time job for college. 24 hours or something like that of ride-alongs was necessary to complete the course, so after the first semester we were shipped off to local fire stations. Most calls were pretty cut and tied, a transport here and an elevated blood sugar there. However, one of my last calls was something I couldn't mentally prepare for. A girl had been struck by lightning. The dispatcher said she was walking home from the mall and struck in the fast-moving thunderstorm. She was only 18. When we arrived to a few mall employee performing CPR on the girl, I just knew there was nothing to be done. Even with no pulse to be palpated nor breath visible, protocol calls for CPR to be performed with a need until the paramedic calls the time of death. I was allowed to intubate her under the direction of the paramedic and rotate in the chest compressions. However, through it all I felt so helpless for her. This girl the same age as me, ready for college yet gone far too soon. I'm an anesthesiologist. Was on trauma call the day of the Boston Marathon bombings. Every OR we had became a trauma room and every surgeon available became a trauma surgeon. Sort of a little known fact, but proud to say that not a single victim who actually made it to the ER alive that day lost their life. There is not a city in this country that is better prepared or equipped to handle an event like that than Boston. Coding kids is always hard. There's a cry of despair that you hear from every parent when they see their child being worked on that wrenches at your soul. It feels like something inside of you is being crushed and your world becomes a little smaller and a lot darker. I worked as a CNA in inpatient hospice and I have more stories than energy to type them. But this one broke my heart. A 17-year-old boy was dying of bowel cancer, meds to his bones and liver, in agonizing pain but mentally still aware. Massive IV narcotics plus medical marijuana only made a dent. As he's laying in bed, his divorced parents are literally arguing over their dying son, demanding he decide whose family plot he wanted to be buried in, rehashing all the reasons they got divorced, trying to make him choose between them, telling stories of all the horrible things the other person had done. It was disgusting. We tried so hard to nudge the parents out when they were arguing, or ask them to stop, but they wouldn't stop fighting and wouldn't leave. All we could do was keep giving him more meds when he asked. Palliative sedation was finally given as it was the only way the poor kid could die in peace. I've never been so furious at other humans before. I work in intensive care and we have to withdraw, pull the plug, on patients all the time when it's clear they'll never survive without all our machinery. The patients are almost invariably unconscious and I'm quite used to making the difficult call and having the unpleasant discussion with the family. The hardest one, though, was a man who had always lived life to the fullest despite having a terrible heart. However, after an emergency operation his heart worsened to the point where he simply couldn't breathe without our ventilator. Every time we tried to take him off, he looked awful and must have felt like he was suffocating. Unlike most of our patients though, he remained all there mentally and knew exactly what was going on. Eventually he asked us to stop, fully aware of the consequences. Turning off that ventilator was far harder than any I've done before or since, with unconscious patients, even though, perhaps because, he made the call himself, and I still don't fully understand why. Nurse here, not a doctor. I had a 27-week infant in the neonatal ICU circling the drain. Children that small with sepsis are really not going to make it. The doctors had spoken with the parents and they understood the outcome. Mom went off the deep end wailing because she wanted the baby baptized. Dad was a born again and did not want baby baptized. He had converted her to his fundamentalist church but she was still Catholic at heart. They were fighting cats and dogs at the infant's bedside. This mother sincerely believed her child was going to heck without baptism, so I baptized him. Catholic hospital. We kept a kid at the desk. Mom and dad weren't wed so she was the sole decision maker. Child died within minutes of baptism. Mom was extremely grateful. The child's father was absolutely furious. He threatened to harm me. My nursing supervisors were absolutely wonderful and backed me up 100%. One of them pointed out that since he didn't believe in it, why was he so worried about it? I read in the paper a few years after this that he had murdered her. Years of domestic violence. I was shook up for weeks. I hope she's with her son now. A 14-year-old girl hung herself and was brought into the A&E where I was doing my pediatrics rotation. We and all of the other people there tried and tried and tried, but was already dead when she was brought in. There was nothing we could do. Her mum had found her and was there with us the whole time, so she could see we did everything we could. I remember her holding her daughter's foot and saying, "What am I going to do now?" We went off and cried, then carried on with my shift. I got yelled at by another parent later for keeping her waiting. Not a doctor but a nurse. I was working in a fairly busy hospital ED when a mom, 22 weeks pregnant, came in post slip and fall on her front steps. We did a workup and I was in and out. She wasn't strictly my patient but I remembered being pregnant and was assisting. Her ultrasound was okay with some decreased fetal movement but the attending said it was okay and they would watch her. When I got off shift she was still there waiting on a follow-up from OB. Around 3 days later I was in the ED again and I hear this blood-curdling screaming coming from the ambulance bay. This like non-human groaning, or I'm not really sure, animalistic cries. It made me viscerally respond. I get out there and it's the mom. She's being pushed by her husband and she's as pale as a sheet and she's dying. Like I could look at her and tell she was dying. Vomiting, fever, extreme pain, sepsis. She was septic. Someone missed the fetal decils and baby had died in utero and she was fully septic. Many washouts. Many codes on the OR table. I beat myself up so much. If I had stayed. If I had checked the chart again, if I had questioned the radiologist. If I blamed myself for a long time. I'll never forget her. I never ever will forget her husband who came in with a family and left alone. I was so angry too. I was angry we had missed that. I was angry at the phys doctrine taking away any chance of justice. I was angry that I felt like I couldn't question my superior officers because I was new. Psychiatrist here. Some 22 years ago, a visiting foreigner was referred to me. She had left her home and native country for the first time and found the experience rather anxiety-provoking and depressing. I sent her to a therapist. The patient had poor comprehension of accents and it was a bit difficult for her to express herself. No big deal at all. Well, I was wrong there in as far as the therapist and the patient interaction was concerned. Therapist came to my office the next day and complained loudly about the person that I had sent. She taxed my patience and drained my energies, her exact words that I remember still. I was surprised. Frankly, I did not and still do not expect such from a therapist or a doc psychiatrist at all. I suggested that she could withdraw if she felt that way and let some other therapist take her over. She shrugged and said, "I will manage it. Have no worries." 3 weeks later I was greeted by the news the moment that I stepped into my department. There was a new case for me. The hospital administration wanted my opinion ASAP on that case. It was the same therapist. The previous day while in session with the foreigner she lost her cool, screamed, banged the table, and as the patient got very nervous, scared and began to cry, I lost it completely. Threw stuff in her office around and had to be calmed down. Another psychiatrist witnessed the meltdown, admitted her and she was under observation. She lost her license and her job. Have a few. 1. Late 30s Asian woman with metastatic breast cancer. Same ethnicity as me. Severe pain from tumors in her bone. Dying any moment. All I could do was try to control her pain with IV opiates. Too much meds made her sleepy and she wanted to be awake to talk and speak with her husband. When she died, her husband was sobbing and put 2 pictures of her kids on either side of her head. He asked me for some scissors to cut a lock of hair. She has just some peach fuzz from recent chemo. Hardest I ever cried for a patient. Felt like I lost my sister if I had one. 2. 20-something-year kid with a rare metastatic cancer. Had taken care of him a few times. There was one time I thought he was going to die. Tumor invading his lung and he was coughing blood. Had a heart-to-heart with him and mom about no resuscitation. DNR. Miraculously he actually got on a drug trial that worked for about 6 months. Was finishing a shift and saw he was in the OR, so I went to see him. His cancer spread and now he had brain mets and bleeding in his brain. He was now partially blind and paralyzed. So brutal. Eventually family took him home on hospice and he passed. 3. 60-year man with liver cancer very advanced. Began to have liver failure and blood pressure dropped. Sent him to the ICU to put him on pressors, meds to artificially keep your blood pressure up. When your blood pressure is too low, you stop perfusing and you die. He was completely awake and lucid. He was not a liver transplant candidate. There were 2 options. Stay in the ICU on these meds until an inevitable complication that will lead to your death, or choose to stop the meds and pass away. His last wish was to watch his favorite NBA team play in the playoffs that night. I was thinking, goddamn, you better win this effing game. They did. He asked to have meds turned off and he passed the next day. This is actually based upon what the doctor said in the newspaper article, but many moons ago, before I was born, my dad got stabbed by his ex-wife. She sliced open something major, and my dad was well on his way to bleeding out. He was in the golden hour. Another guy was brought into the same OR from a car accident and they rushed back and forth between this guy and my dad trying to save them both. The doctor said that they both were within the golden hour, and they weren't sure that either one would survive. He said it was really difficult to make the choice to stop working on the other guy when my dad showed just a smidge more promise that he might make it. Anesthetic to doctor here. So difficult situations aren't uncommon. Ditto sad stories, but some stick with you more than others. The first time I told a family their loved one had died sticks the most. I was working in A&E at the time in Resis, most acute area. Had an alert come in, mid-60s. sick as anything. We threw everything in the kitchen sink at him, but it was very quickly clear he was circling the drain when he arrived. Not unexpectedly, he had a cardiac arrest within 20 minutes of arriving. We got ROSC, return of spontaneous circulation, quite quickly, but it was obvious he was about to arrest again. This time we were unsuccessful. Not an unusual story. The guy had a medical history as long as your arm. Overweight, smoker, heart problems, bad chest. He'd had a bad infection for a few days and his heart couldn't take the strain and failed. This was the first patient who was this sick whose management and subsequent arrest I managed team led, with support. So it fell to me to tell his family, who had arrived whilst we were attempting to bring him back. He had 2 daughters the same age as me, who knew the minute I walked into the relatives' room what I was about to say and fell apart. I kept it together, just to tell them what had happened and that he had died. What got to me the most was they apologized to me and said it must be hard on me too. That really broke me. I returned to the resus room, hid behind a curtain and cried. My favorite nurse bought me a cup of tea. We had a chat and then I moved on to the next patient, but I still remember him and his family. 2 from my intern year. A lady in her 40s, with a husband and a young daughter, was dying from incurable lung disease. Her family decided to withdraw care and donate her organs. It fell on me, the intern on call in the middle of the night, to go to the OR with the surgical team, order her extubated, keep her comfortable with pain medication until she died, and then pronounce her dead so they could harvest her organs. Her brother was allowed to come into the OR as well and he was just holding her head and sobbing. I was sobbing. It took her 25 minutes to die. Also, as an intern, had an elderly man with some decreased cognitive function, who apparently had hit someone with his cane in his group home. He was brought to the OR, I believe for not acting right, and admitted until he could be placed in another group home. Placement was very difficult. We had to use restraints on this patient. One morning he ended up throwing up and aspirating his breakfast. We coded him, but couldn't get him back. It was awful. All because he hit someone with a cane, and lots of other subsequent issues, obviously. Not a doctor, but X-ray tech. Car accident. Mom likely got distracted by her 2 kids coming around a bend. Slammed head on with a pickup, I think. Don't really know the details. Older brother arrives, mostly superficial injuries, but arm is traumatically amputated. Initial plain films for chest, pelvis, etc. to check for big issues. Dedicated views of the shoulder. Nasty amputation. Then plastic stops us and says, "Hey, Pediatric hospital." On the phone, says they'd like to see the other end to see if we can salvage and reattach. I picked up the kid's arm, sitting in the next trauma bay in a tray of ice. Weighed more than I thought it would. I was holding the proximal end, my colleague the distal end with the hand. Honestly felt like I was pulling a chicken breast out of the freezer. Mom and the younger brother never made it to emerg. Found out later that they couldn't salvage the arm. A nurse here had a patient who just before we intubated for sob, said, "Can someone look after my cat?" She ended up dying from a pay. I honestly pulled up her address to see if I could drop food through a mail slot or let the landlord know or something. She had a PO box listed. Of all the stupid stuff that you see, it surprises me what sticks with you. You have been visited by the hamster of joy. Comment, I like chicken to live a happy and full of joy like the joy hamster life. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.